I know your time is priceless, so that's why I will make this as short as possible. I am a mother of six. I have had personal experience with vitamin D deficiency. Not wanting to talk too much about me, I will just let you know that I also had a son that was born with a genetic disorder called HLH. He was just the opposite. At birth, he had the perfect level of vitamin D. So just be careful if you have any special effects. Just consult your doctor before taking it for too long. Because as you may know from your or someone's own experience, having too much of anything, even vitamin D can give you the opposite effect. This product that I am going to share with you and highly recommend is what I take daily and has helped me and my family in so many ways. It is called Liqua D in liquid form. From the company Apex Energetics, all you need is 5 to 10 drops a day. Add it to your hot drinks or just put it under your tongue and let the liquid do its magic. Here is a little more information on the pros and cons of vitamin D. Hope this information helps. Like and subscribe and have a wonderful day.
Welcome to another deep dive. Today we're going to shed some light on, vitamin D. We all know it's the sunshine vitamin, but I bet there are things we don't know. So we're going to separate fact from fiction. We're using this document called The Pros and Cons of Vitamin D. So we'll equip you with the knowledge you need to make your own decisions about, your health.
And you might be surprised to learn that vitamin D is involved in much more than just building strong bones, which most people know about, but it plays a key role in so many bodily functions, like immune health to even mood regulation.
Okay, let's start with the basics. Why is vitamin D so important? We know it's crucial for bone health, but how?
So vitamin D is vital for helping your body absorb calcium. Calcium, of course, is the building block for strong bones. But without enough vitamin D, your body can't use the calcium it's getting. This can lead to problems like osteoporosis, which weakens the bones and can cause fractures.
Okay, that makes sense. So it's not just about getting enough calcium, it's about making sure your body can actually use it.
Exactly, and this is especially important for growing children. Without enough vitamin D, they can develop rickets. It's a bone disease that causes soft and weak bones.
So strong bones, check. But it sounds like vitamin D does way more than that. So what other benefits are there?
One of the most fascinating areas of research is vitamin D's role in immune health. It helps regulate the immune system. The really interesting thing is it can both boost the immune response to fight infection and help keep the immune system from overreacting, which can attack the body's own tissues, which is, well, what causes autoimmune disease.
Wow, that's pretty incredible. So it's not just about fighting off germs, it's also about keeping the immune system in balance.
Yes, exactly. It interacts with specific white blood cells like monocytes and macrophages. These cells are involved in fighting infection and controlling inflammation.
Those sound okay, so monocytes and macrophages. Can you explain those a little?
Think of them as soldiers in your body's immune army. Monocytes are like the first responders to infection or injury. They transform into macrophages, which are like the heavy hitters. They destroy invaders like bacteria and viruses. And vitamin D helps them do their jobs better.
Oh, okay, so it's like giving those immune cells a power up.
Precisely. And it's not just about fighting acute infections. Research suggests vitamin D might help reduce the risk of chronic diseases, including certain types of cancer.
Really? Like which ones?
There's some promising research suggesting adequate vitamin D levels might be linked to a lower risk of colorectal and breast cancer.
Wow, that's amazing. But I'm assuming more research is needed.
Absolutely. It's important to stress that these are still early findings and more research is needed. We don't want to overstate the evidence.
Right. Okay, so strong bones, a supercharged immune system, and maybe even cancer-fighting benefits. Sounds too good to be true. So I'm guessing there must be downsides too.
Well, like most things, it's about balance, right?
Oh.
Vitamin D is essential, but you can have too much of a good thing.
Really? How's that possible? I thought vitamins were safe.
Vitamins are safe within recommended levels, but excessive vitamin D intake from supplements can lead to hypercalcemia.
Hyper what now?
Hypercalcemia means you have too much calcium in your blood.
Ah, okay. And that's not a good thing.
Not really. It can cause some unpleasant symptoms like nausea, weakness, and in severe cases, kidney problems.
So we want to get enough vitamin D, but not too much. How do we even know how much is enough?
That's a great question. It's not just about how much vitamin D you're taking in, it's also about how well your body absorbs and utilizes it, which can vary a lot from person to person.
Yeah, this is where it gets personal for everyone, I think so. Tell me more about that, those individual factors.
Well, first, natural food sources of vitamin D are limited, surprisingly. You'll find it in fatty fish like salmon, sardines, mackerel, but not many people eat those regularly.
I love salmon, but I know what you mean. What about other sources?
There's also beef liver.
Yeah, no, not for me.
You can find vitamin D in some fortified foods,
Mm-hmm.
like some milk, yogurt, orange juice, but it can be a challenge to get enough through diet alone.
Yeah, thinking about it, I don't think I'm getting as much as I thought. So if food is limited, how else do we get it?
The other way is through sun exposure. When your skin is exposed to sunlight, it produces vitamin D. But here's the dilemma.
Uh-oh, I was waiting for a but.
Too much sun exposure, of course, increases your risk of skin cancer. So finding that sweet spot is difficult. You need enough sun to produce vitamin D, but not so much that you damage your skin.
Yeah, so what are we supposed to do? Bake in the sun all day and risk skin cancer, or hide in the shade and be vitamin D deficient?
Neither extreme is good. It's about moderation. And being smart about sun exposure. We'll dive into how to do that safely in the next part, but there's another factor we need to consider. Individual variability.
You're right, we've mentioned that. I want to hear more about how our bodies process vitamin D differently.
Well, absorption rates can differ based on things like your age, weight, and any health conditions. For example, as we age, our bodies become less efficient at producing vitamin D from sunlight.
Okay, so older adults need to pay attention. What about weight? I've heard that's important too.
It is. People with more body fat sometimes have lower levels of circulating vitamin D because it's fat soluble, which means it gets stored in fat cells.
Yeah.
And it's not as available for the body to use.
So even if you're getting enough vitamin D, your body might not be able to use it all.
Exactly. And then, pre-existing conditions can impact your vitamin D levels too. Some conditions, like celiac or Crohn's disease, can affect how well your gut absorbs vitamin D.
It's like this complex web of factors that determine our vitamin D needs. No wonder so many people are confused.
It really is. And that's why talking to your doctor about your individual needs is so important. They can help you determine if you're getting enough and if you should consider supplements.
And speaking of things that might not work, did you know that vitamin D can interact with some medications?
Yes, that's important too. Vitamin D can interfere with some medications, including steroids and weight loss drugs, which could cause complications.
So if you're taking any medications, talk to your doctor before taking vitamin D supplement.
Absolutely. Always be cautious and get advice from a professional.
This is all good information. We've covered a lot, but we're just getting started. Stay tuned for part 2, where we'll explore the practical side of vitamin D, from sun exposure strategies to supplement guidance. Welcome back to our deep dive into all things vitamin D.
It's great to be back. We covered so much in the last part, but I'm excited to, dig deeper into the practical stuff.
Yeah, me too. Last time we were talking about how important vitamin D is, but also how hard it is to make sure we're getting enough without overdoing it. So let's talk strategy.
Sounds good. What do you want to start with?
Well, we talked about balancing sun exposure for vitamin D, but also, trying to reduce the risk of skin cancer, especially, for people who live in places where there isn't a lot of sunshine.
Right, and that's where individual needs really matter. Your skin type, how much time you spend outside, all that stuff. It all influences how much vitamin D you're making naturally.
Okay, so how much sun is enough? I don't want to be scared of skin cancer, but I also don't want to be deficient.
Yeah, it's all about moderation and being, mindful. Short bursts of midday sun without sunscreen can be good for vitamin D production. Think like 10 or 15 minutes, a few times a week, exposing your arms and legs if you can. But really, it's important to listen to your body and, pay attention to your skin. If you feel any burning or see any redness, it's time to cover up.
Okay, that seems, doable. And I guess when you're outside longer, sunscreen is important, right?
Of course, yeah. Protect your skin with broad-spectrum sunscreen, SPF 30 or higher, and reapply every 2 hours, especially after swimming or sweating.
Okay, got it. So that's the sun exposure part. But what about those of us who, can't seem to get enough vitamin D from food, even with those fatty fish and fortified foods
Right, that's a common problem.
Yeah.
And that's where supplements can help. But
Yeah.
even with supplements, it's not, simple.
Right, because we learned that too much vitamin D can be bad too. So what should we keep in mind if we're thinking about taking supplements?
The most important thing is to talk to your doctor. They can check your vitamin D levels with a blood test. They can see if there are any interactions with medications, and they can recommend the right dosage for you. It's about, personalized guidance.
Okay, so it's all about personal advice, whether it's sun exposure or supplements.
Exactly.
And that brings us back to how our bodies, absorb vitamin D differently.
Mm.
Remind us about how age, weight, and, health conditions affect vitamin D levels.
Yeah, so as we age, our bodies tend to produce less vitamin D from sunlight. So older adults might need more dietary or supplemental vitamin D.
That makes sense. And what about weight? You said body weight can affect how we absorb it too, right?
Right. People with higher body fat percentages sometimes have lower levels of vitamin D in their blood because vitamin D is fat soluble, meaning it gets stored in fat cells. So it's less available for the body to use.
So your body might not be using all the vitamin D it gets.
That's right. And then there are the pre-existing conditions we mentioned, like celiac or Crohn's disease. These can affect how well your gut absorbs vitamin D.
It's crazy how complicated it all is, really, for something we just think of as, a vitamin.
I know, it really is. That's why it's so important to talk to your doctor. They can help you figure it all out and make a plan for you.
Okay, so we've talked about the good and the bad of vitamin D and all those individual factors. What's the main takeaway for our listeners?
I think it's this. Vitamin D is crucial for, well, a lot of things. Bone health, immunity, mood. But getting the right amount is all about being balanced.
Right, it's not about, just taking a bunch of supplements.
Exactly. It's about understanding how it all works,
Mm-hmm.
listening to your body, and working with your doctor to make sure you're getting what you need.
And on the topic of understanding how it works, are there any, new areas of vitamin D research that we should know about?
Oh, yeah. There's always more to learn. Researchers are looking into vitamin D's role in cognitive function and neurodegenerative diseases even. It's pretty fascinating.
Wow, that's so cool. So even after all this, there's still so much we don't know about vitamin D.
That's right.
Okay, so before we wrap up this part, what's one thing our listeners can do today to take control of their vitamin D?
I'd say schedule a checkup with your doctor. Talk to them about your concerns, get your levels checked, and discuss any lifestyle changes or supplements that might be right for you.
Great advice. So listeners, go do that. And in the final part of our deep dive, we'll talk about some tips for incorporating vitamin D into your daily routine.
Stay tuned.
Welcome back, Vitamin D Explorers. We've gone through the science, the benefits, the risks, all those individual factors. Vitamin D is, well, it's a pretty complex nutrient.
Yeah, it's been a journey. Hopefully, you're feeling like you understand vitamin D a little better now.
Yeah, I know I do. But now I'm ready to, actually DO something. Last time we talked about, getting personalized advice from your doctor, especially if it's supplements.
Right. But there are also things you can do on your own to, help your vitamin D levels naturally. Like, let's start with food.
Okay, so we know food sources are limited. But are there any, simple changes we can make to our diets?
Sure. Those fatty fish, salmon, sardines, mackerel, they're all great sources. Try to eat those a couple times a week.
I love salmon. But what about people who don't like seafood? Any other options?
Eggs are good, the yolks specifically. And, well, beef liver is another one. Not everyone's favorite, I know, but you could also find vitamin D in fortified foods, like some milk, yogurt, and orange juice. Just check the label.
Okay, cool. Not too hard. But what about people who live in, cloudy places or don't get outside much?
Yeah, in those cases, supplements can be helpful. But again, talk to your doctor first. They can, check your levels and tell you how much to take.
Right, safety first. Okay, let's talk about sun exposure. It's so important, but we have to protect our skin too. So how do we balance that?
Try to get short bursts of midday sun, like 10 to 15 minutes, a few times a week, without sunscreen. Expose your arms and legs. But be careful, and pay attention to your skin. If it starts to burn, you need to cover up.
Got it. And of course, longer time outside, sunscreen is a must.
Exactly. Use broad spectrum, SPF 30 or higher, and reapply every 2 hours, especially if you're, swimming or sweating.
So we've got food, supplements, and sun. Anything else that can affect our vitamin D?
Yeah, your weight can play a role. We talked about how more body fat can mean lower vitamin D levels. So, regular exercise and a healthy diet, they're good for your overall health, A and D, or vitamin D.
It's all connected, huh?
Mm.
Okay, one last question. How do we know if we're actually deficient in vitamin D?
That's easy. Get tested. Ask your doctor for blood tests. It's the best way to, really know your levels.
Makes sense. So as we wrap up this vitamin D deep dive, what's the most important thing for our listeners to remember?
You can take control of your vitamin D health. Understand the science, listen to your body, and work with your doctor. Then you can be sure you're getting enough vitamin D to, well, feel your best.
That's a great way to put it. And remember, this is just the start, Keep learning, keep asking questions, and stay curious about your health.
That's right. Until next time, stay informed and stay healthy.